I'm Dr. William Smith, Chief Medical Officer at Cullman Regional. I'd like to talk to you a few minutes about the situation with COVID-19 at Cullman Regional. Regularly with the medical staff, I do an update as to where we stand with COVID in the hospital and how things have progressed over the past several weeks. We currently are at an all-time high with the number of COVID positive patients in our hospital. We currently have 21 positive patients. 6 of those patients are on the ventilator and 14 patients are waiting on test results. Over the past month, we've seen a progressive rise in the number of positive cases diagnosed through our lab here at the hospital. So these numbers may vary a little bit from what you're seeing at the state level because this is just what's happening in our hospital with our laboratory. So our total positive testing the middle of June was at 5% of the total tests resulted. And at that time we had 7 positive patients in the hospital. 2 weeks later we were up to 6% positive test results and then 7%, and now we're at 9% of those people tested at our hospital are actually positive for COVID. And the people that are being tested through our lab are people who have symptoms or people who are waiting for placement at an extended care facility. This includes patients coming to our emergency department and inpatients. Since the beginning of July to the present, we've seen about a 73% increase in the number of positive test results coming out of our lab, and only a 23% increase in the amount of testing. So it's very important to understand that in the hospital we're seeing more and more positive cases, and it's not a direct result of more testing. It's more people that actually have the virus. At a state level, the testing is up 40% and the positive cases are up 45%. It's a little closer, but still more positive cases than there are actual tests being done. What general precautions can help stop the spread of this illness? Hand hygiene, social distancing, and wearing a mask are 3 major things that can be done. And also frequently disinfecting high-touch surfaces. That kind of goes hand in hand with hand washing. Social distancing typically means staying 6 feet away from somebody if you're not wearing a mask. And if you're within 6 feet for less than 15 minutes, that's typically not considered an exposure. The thing about COVID is that it is highly transmissible. So compared to the flu, a person with COVID will infect 2.4 people, whereas someone with the flu will infect 1.1 person. Both illnesses will spread because they're infecting more people than they have it, but with COVID, it's much more transmissible, and so it's going to affect a whole lot more people. Social distance studies that were done actually show the best distance for social distancing is 24 feet, not 6 feet. So if you look at the studies, 24 feet actually separates you from droplet spread from somebody else if they were to sneeze or cough in your direction. But 6 feet gives you a good protection from large droplets. And by and large, it's felt that COVID spreads by being embedded in large droplets that emanate from somebody when they speak or cough or sneeze. So wearing a mask is to help control the source of COVID. The person that has COVID is the source. If the person that has COVID is wearing a mask, then the likelihood of transmitting it is greatly reduced. Masks are not 100% effective. Neither is social distancing, neither is hand washing, but all of these things combined can make a significant improvement in controlling the spread of COVID. So if 65% of people wore masks and wearing a mask was only 65% effective, the transmission rate of COVID would drop below 1 to 1. So it would drop below the spread of the flu so that one person would not infect even one person. And that's what's required to put a stop to the spread of this illness. People that have COVID frequently don't have any symptoms. So 33 to 88% of people either have COVID and are totally asymptomatic, or they have COVID and they're pre-symptomatic, so they just haven't gotten sick yet, but they're still capable of spreading the illness. That's the reason there's such a push for wearing masks for source control, because there's a large population of people that have it that are out there potentially spreading it, but if they're wearing a mask, the risk of spread is greatly reduced. Studies that were done to look at masks were done years ago before COVID was ever around, and they were done to evaluate whether or not the mask protected the wearer. And the recommendations for mask wearing today is designed to control the source, to protect the protect the person in contact with the wearer from getting it from the wearer, assuming the person wearing the mask might be positive. In our hospital, we require everybody to wear a mask, and we even put masks on patients when healthcare personnel go in the room, because the patients might well be positive even if they're not here for COVID, and we don't want them spreading it to our healthcare personnel. So overall, our policy here at the hospital has been to limit visitors. So we've reduced the amount of people in the hospital altogether. Everyone wears a mask, everybody gets their temperature checked when they arrive, and everybody monitors their symptoms. So symptom monitoring and checking your temperature are important. You know, it's becoming known that not everybody that has COVID has a fever, but they do have some sort of symptoms. The symptoms are very wide ranging, anywhere from headaches, fever, cough, congestion, diarrhea, nausea, loss of sense of smell, loss of sense of taste. All of these are symptoms of COVID. So our testing options here at the hospital, we have 3 testing options. One is called a PCR test, and that's the gold standard test for COVID. It's a molecular test, and currently we are having to send that test out. We use Mayo as a reference lab, and it typically takes about 3 days from the day of the test to get the results back. We recently obtained a Sophia 2 antigen test, which is a test that's done rapidly, so it's one of the rapid tests. It's a very specific test for COVID. If it's positive, you're pretty assured that you're positive for COVID. If it's negative, there's about a 6.5% chance that you could still be positive even if that test were negative. So people who have that rapid test, if they're symptomatic and truly believe they have COVID, if that test were to be negative, those people need to go ahead and have a PCR test as well. The antibody test is available as well, but it's really not providing a lot of utility right now. So it's not something that we're really doing. It does identify people who have antibodies to COVID, and there are studies being done at a national level to see if the plasma from these people was beneficial, giving it to severely ill COVID patients.